Greetings and welcome, everyone. My name is Selena Belisle, and I am the founder and one of the board-approved CE providers teaching massage and bodywork training, mostly for the Florida Board of Massage Licensees, Board of Nursing, Board of Cosmetology, and NCB TMB members. We hope that you enjoy this training unit. This is taken from a larger course, our 5 CE Germs and Sanitation training that we're offering in 2023 at the school. So if you hear me referencing other training during this brief video, or if you want to learn more, you can come to our school website. It's ceinstitute.com, and you can purchase the whole training beyond this little tiny unit, or you can look for other training that's available at our school as well. We just came out of the COVID-19 pandemic, and we are in this huge flu respiratory outbreak right now, this viral outbreak. And as massage therapists who work usually in very small treatment rooms, right? I have worked in literal closets converted into treatment rooms in a medical office, okay? So sometimes in these areas, there's really poor ventilation. You are exchanging respiratory backwash with your client for an hour straight, and that puts us at risk. Because we are at high risk during respiratory outbreak in the massage and bodywork industry, I decided to put out this training of how you might be able to better protect yourself with socially distant service. These are a suggestion of the services that you might be able to do and how to provide them to avoid respiratory viral disease. I wrote an article for a spa industry trade magazine during COVID-19 called Aesthetic Social Distancing. These techniques and alterations can also be applied for the massage and bodywork industry. I'm sure you know that it is impossible to maintain the recommended 6 feet of distance from another individual to prevent the acquisition or transmission of some type of viral respiratory disease if you want to practice massage. Massage therapy is one of those careers that requires prolonged personal contact. There are very few professions like ours where you need to be almost on top of your client, usually for an hour at a time. Another profession that would be at great risk is something like a dental hygienist. But aside from those types of long times of spending in your mouth cleaning your teeth, massage therapy has got to be at the top of the ladder, is one of the highest risk careers when you're in working in a pandemic like COVID-19. Massage therapists and body workers are in an impossible situation to safely keep their careers and keep working during something like a respiratory pandemic. But there are some things that you can do to make yourself safer if you cannot self-isolate and if you must work. As such, we recommend the following approaches if you are going to work in the massage or bodywork industry during a pandemic such as COVID-19. During a pandemic that's caused by respiratory transmission, we would recommend in a business operation, if you must remain open, to try and promote things like do-it-yourself services. When I go to a very famous spa in Miami Beach, one of the things they offer are these tubs, and then they give you a cup of body scrub that you can place on yourself after your tub and shower off. So these are called do-it-yourself services. Maybe you have a shower and you can provide aromatherapy gels for the aromatherapy shower. The less amount of time you are breathing another person's air and they're breathing yours, the better chance you have to avoid transmission and acquisition of any viral or bacterial contagions that they have. So do-it-yourself services are a wonderful way to maintain income. It might not be as much as your hands-on services, but if somebody has a gift certificate or something and they want to come to your establishment, that might be a way to make yourself a little bit safer in recommending services where they can still enjoy the spa without prolonged person-to-person contact with do-it-yourself service. I don't know what the setup is of your establishment, but think about anything that you can provide in your establishment. Things like foot soaks. You can get a still bowl. You might be able to get one of those bubbly jet things that you can sanitize properly in between clients, and have a client sitting in a room with her foot soak and then doing reflexology in the pronated position. There are many different options in how you can create social distancing in your massage practice beyond working directly over a supinated client. We'd like you to provide the greatest amount of massage or bodywork service in the prone position, where the client is face down, breathing onto the floor instead of breathing up and outward towards you. The goal is to avoid exposure to the client's airway and respiratory backwash. Body massage and body scrubs and body wraps, spa service type bodywork appointments can usually all be performed in the pronated position. So you can usually have a tremendous amount of the service time with the client face down, breathing onto the floor instead of onto you. To address the anterior side of the client's arms or legs, you should simply rotate the arm or leg while the client is in the pronated position. Now, if a client has had a recent hip or knee transplant, you would not rotate the leg because that could dislodge the replacement and prosthesis. So make sure when you are rotating arms and legs, working with clients in pronated positions, you provide a qualified medical intake health history process with your client to learn of any possible massage precautions or contraindications before your massage or bodywork service. The most likely highest risk of viral transmission with something like a cold, flu, or COVID-19 is when you're sitting at the top of the table working over the client's face and airway. You want to avoid and stay away from the client's airway as much as possible. That means create as much distance between your airway and the client's, and also if you are going to have close contact with the client's airway, minimize the amount of time you will have that close contact. One of your biggest challenges when working with your pronated clients is trying to provide the entire service, including the surface area of the anterior body in the pronated position. When the client is pronated or face down, what you should do is flex the knee. And when you're flexing the knee, you can do the anterior portion of the lower leg. And you might also be able to scoop underneath the quadricep with your headward hand while facing the client. Reach underneath and press down on the table and scoop upwards. And that will help you be able to reach the quadricep. When working the client's upper body, such as a back massage, we recommend standing at the side of the table and working up from the hips rather than standing at the top of the table and working from the cervical down. We recommend this because, again, we're trying to keep your airway as far away from the client's airway as possible. And if you're standing at the client's hips, working superiorly, that's going to keep your airway further than standing directly over the client's head. Sometimes you'll have clients that are not able to tolerate a pronated position. We will show you how you can make pronated position for prolonged periods of time more tolerable in a minute. But let's say you have a client that says they have vertigo or something when they're lying face up. What we would recommend is to try and work on their feet and stay as far away from their airway as possible. And you can make things up with your spa menu, such as a foot makeover. To provide your foot makeover, maybe you'll have a foot soak first where you don't even stay in the room. And then after they're in their foot soak, you will have them get onto your treatment table. And you can do things like a scrub and a mud mask. You might wrap their feet in hot towels and maybe some saran wrap too, and leave them in the room masking for a little bit, and then remove the mud mask and maybe massage the feet for a little bit afterwards. Okay, you can massage up the lower leg while you're massaging the feet. Your airway is not going to get that much closer working on the client's calves and peroneus and tibialis anterior and so forth. Keep in mind that you should check your scope of practice. I'm teaching here in Florida, and body preparation treatments, which would include scrubs and wraps, are included in a licensed massage therapist scope of practice. But if you're in a different state, your scope of practice might not allow this. You might have to get a separate license, or it just might not be practiced within any scope of a body worker. So check with your own state board and your own scope of practice before you start providing body work beyond standard massage if you only have a massage license. Just remember that in massage therapy and bodywork social distancing, your goal is to simply remove yourself from the client's airway. And if you cannot remove yourself, try and create as much space as possible between your airway and the client's. Now, some people experience great discomfort lying in the pronated position, especially for long periods of time. And that's because their sinuses might become congested and full, and maybe even bring on a full-on sinus headache. To help your client prevent or delay having their sinuses become congested when lying in prolonged periods of time in the pronated position, if you have a portable table like what I'm showing right here, you can unscrew the leg knobs, and you can either lower the rear legs of the table one notch lower or the front legs of the table one notch higher than the rear. And this should create a slightly inclined position where the sinuses will be a little bit higher than the back end of the table. Usually when we're on a slightly inclined position, our sinuses are less likely to become congested. Now, if you have an electric table that can do this for you, even better. But the goal is to try and get the sinuses a little bit higher, and that's while maintaining the client in the pronated position so that you can avoid airway to airway contact with the client. The client's face should also be in a face hole on the table or in the face cradle cushion with a face cradle holder. You should never allow your client to turn their head sideways and allow them to exhale into the open air. If you can get the client into a pronated position, that's preferred. Anytime the client is exhaling directly into open air that you are breathing, puts you at risk in any type of respiratory pandemic or during respiratory disease outbreak. There is a difference in face cradle cushion quality, okay? And this is going to make a big difference when you have clients for prolonged periods of time in the pronated position. Our recommendation is to do some research and try and find face cradle cushions that directly address avoiding sinus pressure and congestion buildup during table service, okay? We're not going to recommend, we're not allowed to recommend one face cradle over another, but I will say that there are face cradles out there that have different substances within the cushions themselves, and here's an example with those green balls in the foam. Different table manufacturers and equipment supply manufacturers have come up with clever little tricks to help alleviate sinus pressure. Sometimes these face cushions could be as much as $100. But ask yourself, how much do you charge for a service? It might be just the price of one $100 massage to buy a face cradle. But if the client's comfortable, they might keep on coming back to see you. They might prefer to be in the pronated position because they might be afraid of your respiratory backwash. Okay, I know I prefer to stay in the pronated position at the beginning of COVID-19 when I went for a massage. So when I was provided a better quality face cushion, I appreciated that, and I was more likely to go back to that provider because I knew I was comfortable with their upgraded equipment. If you provide chair massage, it's recommended to stand on the side and preferably in the back of the client. You would avoid standing in front of the client where they're breathing onto you, even though, it might be towards your abdomen and chest area. That respiratory backwash and aerosol will be all over you when you're standing in front of somebody breathing onto you. Remember, the goal is to create as much distance between your airway and the client's airway at all times. You want to keep a window or door open or any available opening to your treatment area as much as possible, as long as your client's privacy is protected at all times. Working in closed workspaces, such as a small treatment room, is very high risk for respiratory exchange. Keep in mind that when you open the doors and windows, there's been studies about this, the viral contaminant level of something like a respiratory disease is much less when there's proper ventilation and filtration processes for air. And even if you are able to follow all of the recommendations we're making in this social distancing practice training, it's still recommended to wear masks during respiratory outbreaks. Unfortunately, there's no guarantee or safety protocol that we can provide you to give you an absolute certainty that you can avoid all chance of something like a COVID-19 acquisition or transmission during massage or body work during this pandemic. Instead, if you must work, we want you to get creative and think about out-of-the-box suggestions of how you might work to try and avoid the client's airway and create social distancing. Remember, 100 years ago, during another flu pandemic, they used self-isolation, quarantining practice, and so forth to avoid viral transmission. Okay, that practice is still going on today. It's effective. So when you're practicing, your goal is to simply avoid inhaling a virus from your client. And to do that, as a massage therapist, you just want to simply try and avoid their airway as much as possible. So we hope that information helps and you'll be able to make yourself and maybe even your clients a little bit safer when you're not having direct airway to airway contact and exchange during body work and massage services. Now again, this was just a small portion of a training unit that's in a greater 5 CE hour germs and sanitation training class for massage therapists and body workers. If you want to learn more, we have training available 24 hours a day, 7 days a week at school. You can register for home study training on our website. It's CE as in continuing education, so ceinstitute.com. Keep in mind, as a continuing education provider, our training is geared towards people who have already graduated their trade and regular schools such as nursing or massage and so forth. So we're relying that you're going to apply your rudimentary training to these continuing education practices and suggestions that we're making here at our school. It might be difficult to build upon with our training if you do not have that rudimentary training in place. So this is really for people who are already graduates and licensed healthcare providers to help them a little bit further beyond their initial rudimentary education. So we hope you enjoyed. And until we see you in another training, be safe.